Madison making waves with the decision to remove fluoride from its water supply. Madison Utilities proposed the idea back in March, claiming the decision was made for employee health and safety, structural degradation of treatment facilities, and maintenance costs. The Board for Water and Wastewater Management approved the motion last week, and it's set to take effect on June 16th. But many aren't happy with the decision, pointing to health impacts the removal of fluoride could cause, especially in children's teeth. Tonight was the first Public Utility Board meeting since that decision was announced. Here's a listen.
There was one commenter at the council meeting who brought up the item on the agenda. It said something like chemical feed discussion, which wasn't entirely clear what was going to be, up for debate. So I think, maybe they could have put a little more detail into what that was going to be.
I am very disappointed with the decision to take fluoride out of our public water. I'm also disappointed with the transparency, the process, the lack of time, effort, and research put forth by Madison Utilities, and the lack of communication between Madison Utilities and citizens.
I would like to remind the board that as a public utility, that your obligation is to serve the public and to serve the people and to give us what we need. We need safe, healthy, fluoridated drinking water. And if you can't make this decision by yourself, without doing research, you need to bring other people into the process.
I'm concerned that when you drive down demand to live here from decisions like this, you're going to drive down demand for property values, and the people that already live here are going to suffer from that, possibly move away. I've actually talked to people that work at Raytheon Technologies, that's one of my backgrounds, and they are talking about no longer moving to Madison because of this. It's an actual consideration because it has become such an issue.
I think the most credible science has been around for over 80 years for the benefits of fluoridation. We certainly also know from a science perspective communities that have done this and how it was the children who had the most incidents of problems from this. I want to see us avoid that as the city of Madison.
No decision was made tonight, but the community definitely gave the utility board some things to think about before the change takes effect next month.